Hello, Insta fam. It is Dr. T here coming to you on Thursday night. Not my usual Wednesday night, but we've got a very special announcement. We have some winners of our CHARLI Health app prizes. So I have a list actually of those who have won. So hopefully you guys are all going to get on so I can award the winners. But we will do our usual Q&A tonight because I am heading off to ESHRE tomorrow night, the European Society of Reproductive Endocrinology and Infertility Conference, the biggest fertility conference arguably in the world. Some 10,000 people from around the world go to this conference every European summer. This one happens to be in Amsterdam. It's a place I've never been before. In fact, this is a conference that I have never been to before. So I am super excited to head off. But, CHARLI Health, you guys are on. Amazing. So, over the last week and a bit, we have had a competition to win 9 prizes of, I've just had a mind blank, subscription to CHARLI Health app for you to go and sign up. And what you get is you get a 6-month subscription to CHARLI Health app. So I have a list. I'm going to read them out and then I'm going to write them in the comments and then I'm going to send each of you who is a winner your code that you are going to be able to use. And when you go into the CHARLI app in the App Store, you will just need to enter your code and that will get you a 6-month free trial. And I would really encourage you to throw yourself in, deep dive, head first, fill out all the details, use it extensively, because what this app can do to you with the artificial intelligence is next level. So I think it's really important that if you're going to use it, use it well. If you don't think you're going to use it, please hand the code on to somebody else who you think would really benefit. Okay. We've got a few people jumping on, so let's go through our winners. There are 9 of you. I'm not going to tell you how I chose them. The first winner of a free subscription, 6 months to CHARLI app, is Emma D. Clark. Emma D. Clark, you are a winner. Fantastic. I will send through your code. Libstar 1987. Libstar, I know you're on here quite a lot, so thank you. And your code will be coming out to you. Number 3 is Shauna Jane. Shauna Jane, kind of like Lorna Jane, really. Shauna Jane, you are the 3rd winner of our code. That will be coming out to you in a DM. Our 4th winner, almost halfway there, Erin Kuzmicic. Erin K. You are our 4th winner and I will be sending your code out to you via DM. Number 5 is Miss Mia _16. Miss Mia _16. You are the 5th winner of a 6-month subscription to CHARLI app. Our next winner, where am I up to? Number 6 is Katrina _Shenavia. Katrina Shenavia. Fabulous. Your code will be coming out to you. Next one on our list, number 7, we're getting through, is Tiff.Spencer _ Congratulations, Tiff. A 6-month subscription code coming out to you as well. Number 8, nearly all the way through, is Stronger.Amy. Stronger.Amy, a code coming out to you. Check out your DM. And the last one. Oh, Tiff, you're on. Hey, you just won a code, so it's coming out to you. And number 9, our last code, 6 months free subscription to CHARLI app is Olivia Long. Well done. So there we go. I'll read them out again really quickly. Emma D. Clark, Libstar 1987, Shauna Jane, Erin Kuzmichik, Miss Mia 16, Katrina Shenavia, Tiff Spencer, Stronger Amy, and Olivia Long are all winners of our 6-month subscription to CHARLI app. And like I said at the beginning, dive in head first, like explore the app, get really involved, because the more information you share about your cycles, about your history, about your just women's health, the more you're going to get back from the AI component of the app. And I think it's going to be really, really helpful for you. So well done, guys. Keep an eye out in your DMs for those codes. They will be coming through to you. And then go check out the app. So well done. Now, I have had a few questions come through. And interestingly, the theme of the questions coming through this week have been endometriosis related. And the one big question I want to address is someone who asked a question about endometriomas. They had an endometrioma drained at their most recent egg collection, and they were worried about the impact. Does endometriomas represent severe disease? Is an endometrioma problematic for IVF? Is IVF problematic for ongoing development of endometriomas? So let me give you the kind of potted summary. An endometrioma is the development of a cyst from endometriosis on the ovary. And we commonly call these chocolate cysts. So when you open them up, there's all this really dark brown old blood. And yes, it looks a little bit like liquid chocolate. It's a bit gross. So endometriomas are problematic for a number of reasons. Yes, they can signify significant disease, but interestingly, there are some girls who will just have endometriomas, often bilaterally, and they don't really have any other disease in the pelvis. So it's an interesting pattern of disease, but it can reflect quite severe disease. The problem with endometriomas themselves is that they will often suppress the development of follicles on that particular ovary. The mechanism we don't really understand, but when you stimulate a woman in IVF, it's not surprising that they may not get good follicular development on that particular ovary. So the question is, do we take out those endometriomas prior to them having stimulation, or do we leave them there? And there is a bit of controversy around this, because when you operate on these endometriomas and strip them, which is really the only way you're going to prevent them coming back, you do quite a bit of damage to the ovary itself, and you can actually significantly impair the ovarian reserve, so the number of remaining eggs in that ovary, by doing the surgery. So one of the things that helps us determine whether or not to go and operate is actually someone's antral follicle count, both sides, but particularly on that side. And if someone has a low ovarian reserve or a low antral follicle count, often we'll say, do you know what, let's just collect and freeze eggs or freeze embryos first before we go doing any surgery in the pelvis, because it's a terrible outcome when you operate on an ovary and you kind of render somebody sterile by doing that kind of surgery. So it is often a discussion point to have with the patient. Do you treat the endometrioma before or after? Obviously, by leaving the endometriomas, that is going to be inflammatory within the pelvis, which can impact on embryo implantation. So there is a discussion point as to whether you remove the cyst in an interval fashion before you do an embryo transfer. Endometriomas themselves can respond to estrogen that is produced when you have a stimulated cycle. As many of you know, when you have IVF, your estrogen goes really high, and we can see progression of endometriosis and endometriomas in girls having stimulated cycles because of that higher level of estrogen. So they are very difficult to decide to manage. Do you go and drain them during an egg collection? That's not my practice. And the main reason why is I'm actually not sterilizing the vagina when I do an egg collection, because to do that, you actually can cause potential harm to the eggs. And so then I'm sticking a needle through an unsterilized vagina and then straight into a cyst that contains old blood, which bugs just love. And so the risk of developing something like a tubo-ovarian abscess is significant if you're sticking a needle into an endometrioma at the time of an egg collection. So antibiotic cover is really, really important. So I mean, there's just a couple of tips about endometriomas. They are certainly worth discussing with your fertility specialist. Is this something I manage now? Is this something that I manage in an interval fashion? Do I leave it until I've finished my family? But it is an important thing to really consider. So now somebody has asked a question. Hello, Olivia Long. If you're on, you have just won one of our codes, so well done. Look out for that in your DM when I've gotten off here. Ella White asks a question, what's a frozen pelvis? Oh, another endometriosis related question. So a frozen pelvis is someone who generally has had severe endometriosis causing scarring, and that scarring has led to all of the reproductive organs sticking together. So often the tubes and ovaries are stuck into the pelvis. Often the bowel is become adherent to the back of the uterus, and what that does is obliterates the pouch of Douglas, which is the space between the back of the uterus and the rectum itself. And so everything's kind of stuck together. It's not a nice scenario. It is pretty severe disease. Often it means sort of tubal damage. Clearing a frozen pelvis often means taking out all of the reproductive structures, so tubes, ovaries, uterus. It's not a nice scenario. So those are the sorts of surgeries that are done by very experienced laparoscopic surgeons, so those experienced in endometriosis, or even sometimes gynae-oncologists are the best to do that kind of surgery. But that's what a frozen pelvis actually means. Anyone else have any quick questions? I've got to go and pack. And you know what? I have just looked up the temperature in Amsterdam, and despite the fact it is the middle of summer and the sun stays up until about 10 p.m, the temperatures are kind of how they are in Perth in the middle of winter. So I'm just thinking about packing my winter gear to go to Amsterdam in the summer. But if you have any suggestions as to places that I need to go, I have had a couple of suggestions. No, I will not be going to the red light district, but I certainly am interested in going to some museums. So if you've got no problems, Ella White, very happy to have helped you with that. Any other questions? Please dump them into the comments section. Anything else that you would like to know? Otherwise, I'm going to jump off and go and pack my case. Heading off to ESHRA. First time ever. I've been wanting to go to that conference for 15 years, but I've always been the one that stayed behind and done the egg collections while everybody else heads off to ESHRA and a European summer. So I'm quite excited to be going. It's going to be a very quick trip. I will literally be there for 4 days, and then I'll be turning around and coming home again to all my beautiful patients, so that we can keep the fertility journey going. No more questions. That's it from everybody. You're stunned into silence. Well, don't forget, next week I will not be online at my usual time. However, do keep an eye out, because I will be dropping you some fabulous info from my time in ESHRA. If there's anything new and fabulous, don't you worry. I will definitely share it with you, but I'm really looking forward to spending some time with some colleagues from all around the world, doing a presentation for the first time on the stage, presenting some material, and just getting amongst it. I'm going to have a great time and hopefully learn some new skills. So I will see you guys later. To those of you who won our contest, congratulations. The code will be coming to you via direct message. And to anyone else, get online and check out CHARLI app because it might just change the way you manage your women's health. See you later.